How are the best antibiotics chosen for prostatitis? Deciding which antibiotics are best for prostatitis involves understanding several important factors. First, the type of prostatitis matters a lot. If it is an acute bacterial case, it needs quick treatment based on symptoms and urine tests. For chronic bacterial prostatitis, doctors usually confirm the infection with specific urine or prostate secretion cultures to identify the bacteria causing the problem. Sometimes, if bacteria are suspected but not yet confirmed, doctors start treatment based on common pathogens while waiting for lab results. Another key point is how well the antibiotics can reach the prostate tissue. The prostate has a unique structure that makes it tricky for some medicines to penetrate effectively. Fluoroquinolones, like ciprofloxacin and ofloxacin, are often the first choice because they penetrate prostate tissue well and work against many bacteria that cause urinary infections. If a patient cannot take fluoroquinolones or if the bacteria are resistant, doctors might consider other options like trimethoprim sulfamethoxazole, doxycycline, or cotrimoxazole. However, tetracyclines like doxycycline are generally less effective because they don't reach the prostate as easily and may not work against all bacteria. Beta-lactam antibiotics such as amoxicillin or cephalexin can be used in some cases but are usually less preferred due to poorer penetration. The length of treatment is also very important. Because getting antibiotics into the prostate is challenging, treatment usually lasts longer than for other urinary infections. For acute bacterial prostatitis, antibiotics are typically given for at least 2 to 4 weeks, sometimes extending to 6 weeks in severe cases. For chronic bacterial prostatitis, treatment often lasts for 2 to 6 weeks or longer. Sometimes, if symptoms persist or infections keep coming back, doctors may extend the course or repeat treatment. Patient factors and resistance patterns play a role too. If a person has allergies or has taken antibiotics recently, these factors influence the choice. For younger men who are sexually active, infections like chlamydia or gonorrhea can cause prostatitis, so antibiotics like doxycycline, azithromycin, or ceftriaxone are often used. If bacteria resistant to fluoroquinolones are common in the area, doctors might opt for longer courses of drugs like cotrimoxazole. In addition to antibiotics, managing symptoms is important. Doctors may recommend medications such as alpha blockers to ease urinary symptoms or pain relievers for discomfort. Monitoring how well the treatment works is essential. If there's no improvement after a few weeks, the therapy should be reassessed. It's also worth noting that prostate-specific antigen tests are not routinely used to guide antibiotic therapy because PSA levels can be elevated during infection, but usually return to normal after treatment. Overall, choosing the right antibiotics for prostatitis depends on understanding the infection type, identifying the bacteria involved, ensuring the medication can reach the prostate effectively, and considering individual patient factors. Fluoroquinolones are often preferred because of their good tissue penetration and broad spectrum, but treatment duration is longer to ensure the infection is fully cleared. Always remember, proper treatment should be guided by a healthcare professional who can tailor therapy to each person's needs. Proper management of prostatitis is important not just for comfort but also because ongoing inflammation can sometimes complicate prostate health and screening for conditions like prostate cancer.